Hello friends, today we'll discuss about ABG, Arterial Blood Gas Analysis. The process of analysis and monitoring of arterial blood gas is an essential part of diagnosing and managing the oxygenation status and acid-base balance of high-risk patients in the critically ill who is there admitted in the intensive care unit. We measure the pH or acidity or the level of PaCO2 with the ABG and understand how well the lungs or kidneys are doing. The important terms which we have to understand are PaO2, PaCO2, bicarbonate HCO3, anion gap, base excess, and pH, that is proton levels in our body. The pH reflects the acid-base balance and it responds to the metabolic and respiratory changes. The body cells are very sensitive to the pH of their environment, and hence if a lower pH is identified in an ABG, it is termed as acidic. If an higher pH is identified, it is called as alkaline. A deviation from normal pH is always resisted by three mechanisms in the body: the buffering system over the body and the body fluids, the lungs, and the kidneys. Respiratory acidosis is due to some lung diseases in the body or sometimes a neuromuscular diseases. Lung diseases per se is directly correlated to inability to deliver oxygen or eliminate the carbon dioxide from the body, hence causing more and more amount of protons being accumulated in the body and hence causing lower pH, that is the respiratory acidosis. So in an ABG interpretation, a low PaO2 will directly denote a type 1 respiratory failure, and if a high PaCO2 level is identified, then it is termed as type 2 respiratory failure. So further going into the interpretation of respiratory acidosis, if a PaCO2 level is higher than 45 millimeters of mercury, and if the pH is lesser than 7.35, it is considered to be respiratory acidosis. If the pH is normal and the bicarbonate is growing up or it is higher, then it is called to be a compensated arterial blood gas. A bicarbonate is high when a more and more bicarbonate is retained within the body. A PaCO2 and bicarbonate is high but the pH is notably lower, that is lesser than 7.35, then it is to be a partially compensated. If a PaCO2 and the bicarbonate is both abnormal and pH is very low, then it is called as uncompensated ABG. On the other hand, metabolic acidosis is due to increased acid production, or if a person has ingested an acid, or if the body is not able to excrete the acid, and sometimes if a gastrointestinal or renal bicarbonate is lost. At that moment, we tend to have more amount of protons being accumulated within the body, hence termed as metabolic acidosis. The very concerning acidosis will be when a high anion gap acidosis being formed within the body due to illnesses like ketoacidosis, lactic acidosis, or renal failure, or acute methanol ingestion. A compensated metabolic acidosis will have a normal pH with a very low bicarbonate but very low PaCO2. But in a non-compensated metabolic acidosis, we can directly say there will be an abnormal bicarbonate and a PaCO2 level with significant pH value lesser than 7.35. After this, we shall understand how to analyze an ABG step by step. First, you understand the pH. If the pH is less than 7.35 and within 7.25, it is considered to be mild acidosis. If a pH is lesser than 7.25 and within 7.15, it is considered to be moderate acidosis. and if the pH falls below 7.15, then it is considered to be severe acidosis. Next, we understand how we correlate with pH, PaCO2, bicarbonate and infer their values. If a pH is low and if a PaCO2 is high and bicarbonate seems to be normal, then we can consider it to be a respiratory acidosis. If pH is low, the PaCO2 seems normal, the bicarbonate is low, here bicarbonate is low, so it can be confirmed that it is a metabolic acidosis. If a pH is low, the PaCO2 seems very high, bicarbonate is very low, then it is considered to be mixed acidosis and it is very dangerous. So we have to have a multi-organ failure in the patient. So we have to be very cautious in treating the patient. This picture denotes a scale wherein any value on the left hand side is considered to be acidosis and any value on the right hand side is considered to be alkalosis. In numerical value, if a pH is lesser than 7.35, it is acidic, and if the value pH is more than 7.45, it is considered to be alkaline. Similarly, if the PCO2 level or PaCO2 level is more than 45 millimeters of mercury, it is considered to be respiratory acidosis, and if the bicarbonate value is lesser than 22 or low bicarbonate level, it is considered to be metabolic acidosis. Body tries to compensate with the help of kidneys or the lungs to compensate an acidic medium. In case of respiratory acidosis, if it is an acute respiratory acidosis, body tries to increase the bicarbonate level by 1 millimoles or 1 milliequivalents per liter for every 10 millimeters increase in PaCO2 levels. Similarly, if a body has already been having a respiratory disease and it is going into chronic respiratory acidosis, every 10 millimeters increase in the PaCO2 levels, there will be increase of 3.5 millimoles or 3.5 milliequivalents of bicarbonate levels. But in metabolic acidosis, the compensation seen in the respiratory part would be like if a bicarbonate level has gone down, is lesser than the 22 millimoles per liter, then we can get a value of expected compensation of PaCO2, that is 1.5 into the value of bicarbonate plus 8 or plus or minus 2, which will give you an exact idea that how much PaCO2 would be there in the body for compensating a severe metabolic acidosis.